Hi guys, my name is Alexis and this is Camila and welcome back to my channel. In this video we are going to be talking about Camila having her first heart surgery. Camila's first heart surgery was on May 12th. So we did have to do some pre-op stuff before the day of her heart surgery. So I believe it was like 2 or 3 days before Camila had to get a COVID test. During the time of the COVID test, Camila was barely going to be 2 weeks old. So I was very nervous about her getting this COVID test just because I had been seeing online that they do it through the nose. The pictures online were just showing like them going through the nose really deep, and it made me so nervous because she was so tiny. She was just barely going to be 2 weeks old. They were going to be doing this COVID test on her. But once we got to the location where she was getting her test done, they just did it through her mouth, and that was that. And they said no news was good news. And then the day before was May 11th, Camila had her pre-op appointment, and that was a very long one at the hospital. So during that appointment, Camila had an echo done, Camila had some x-rays done, Camila had some blood work done that day too. And that was very hard for us because getting blood out of a 2-week-old is very, very difficult. I mean, they poked her multiple times, and at first it was just 2 nurses, and they got the smallest needle that they had up there, and they were poking her. I think they poked her like 2 or 3 times, and the needle was in, but no blood was coming out, so they couldn't get a vein. And finally they got another nurse, so it was like 2 people holding Camila down and a third one poking her to get the blood. And at this point Camila had been screaming and crying, and it was just very hard for us to see it happen. I mean, at one point the nurses there were like, you guys could step out if it's really difficult, and we didn't. I mean, it did make me really sad. I mean, Camila was just crying the whole time for what felt like forever. I think it was like 20 minutes of them just trying to get some blood out, but that was really tough. That day we also talked to her surgeon, and they just one last walkthrough of what her PA band surgery was going to look like and what that was going to look like and how long that would take. Just like walk me through that would happen on May 12th. Another thing that I really appreciated that happened that day was there was somebody that worked at the hospital. I forgot her job title and what she did, but what she did is she explained to us every IV and line that was going to be on Camila. They showed us pictures of a different baby and an older baby, but they wanted us to see it and to kind of know what to expect. So there was an IV on each limb, and I think one of them had 2. There was a possibility of Camila also needing a central line that would be closer to her neck. She would also have RA lines that would be coming out of her incision, at the bottom of her incision. Camila would also be having a drain tube just to drain any excess fluid. So all of that we were told the day before surgery during that pre-op appointment, and they were showing us pictures of this just to know what to expect, just so we weren't caught off guard. After the really long appointment, it was evening by the time we got home. We really just wanted to spend as much time as we could with Camila. I mean, we knew what was coming, we knew surgery was coming, and recovery for the surgery was a little up in the air of how long it could take. It was really more up to Camila and how fast she would recover. The doctor had told us that Camila would probably spend more time in the pediatric intensive care unit working on her eating than her being recovered from her surgery. Her heart surgery would probably be recovered way before she would go home, just because she would need to make sure that her eating was back on track. We still didn't have a clear number of would it be 2 weeks, 3 weeks in the hospital. We just didn't know. So that evening, our parents of course wanted to see Camila before her big surgery. So that night Ben's parents came over first and got to spend some time with Camila and got to hang out with us, and they were here for maybe an hour or 2. And then that night my mom, dad, and my little sister came over, and they were going to sleep over here. So because Camila was still waking up every 3 hours at night and stuff to feed, my mom knew like I wasn't gonna get a lot of sleep the next few days with Camila's surgery going on and her recovering and just with everything going on. So she said, I'll come over, me and your dad and my little sister will come over, and I'll feed Camila go ahead and get some sleep, and in the morning, you know, you could be with Camila. It was just important for us to get some rest, which I know I really appreciated that. It was very much needed for sure. It was nice just to have my parents and my sister over to be able to hang out with Camila before her surgery. They were used to seeing her every few days, and it was going to be the first time they weren't going to be able to see her for a few weeks at least, just because of the hospital rules. There were going to be no visitors except me and Ben. So it was gonna be lots of FaceTime calls in the PICU for sure. That night came and I was able to get some rest, and my mom was with Camila, my mom and my dad. And I think it was about like 3:34, we woke up and I just wanted to be with Camila. Me and Ben really just wanted to hold her. It was just hours before surgery, and we just wanted to spend as much time as we could. So my parents and my sister said their goodbyes to Camila, and you know, their goodbyes for a few weeks until she came back home from her surgery. And it was just me, Ben, and Camila at that point. We just really wanted to spend as much time as a family as we could before we were going to go into surgery, and we knew surgery was going to be very hard. So it's about 5. I started getting changed. I just put on some comfy clothes because I knew it was going to be a long day, and we get Camila in her car seat. It's about 5:30, and we head over to the hospital. We stop for some coffee, go to the hospital, check in at a little bit before 6, and we get taken back. And so once we check in, we get taken back to her pre-op room. In this pre-op room, a nurse comes back with us, and she takes Camila's vitals and just verifies all of Camila's formula and her feedings and make sure like we have all the correct information. The surgeon and the anesthesiologist both come into the room, and again, they get consent, so I have to sign consent, and they go over every step of the surgery, and the anesthesiologist goes through all of the risks that come with the anesthesia and lets me know like what his role is in the whole surgery. They both want me to ask any questions I have before we go into this. Something that was very sweet was her surgeon came and gave us a little gift, and it was a little girl holding like a golden heart, and it was really cute. It was a gift we still have on one of our shelves, and we just keep it on display. It was really cute and really special. So once all that is done, we are just in this pre-op room, and this is our time to just be with Camila. At this point, we're just waiting for the nurse to come and get Camila to take her back into the operating room. And it's never enough time. It's never enough time to just hold your 2-week-old baby right before surgery. I was holding Camila, and I didn't really know, but Ben was taking a lot of pictures during this time and videos, and I didn't even know he was doing it a lot for a majority of the time. But I really appreciated having those pictures.
Ooh. Oh, she's so cute.
You are so weak. You're weak and ready to go, aren't you?
Camila.
Hello, Dad. Hello, Daddy. Hello.
Hey, cutie.
I'm doing so good, Dad. I'm doing so good during my surgery.
She's so pretty. This camera doesn't do it. Gee, look at all that hair.
A lot of these pictures are Camila without her scar. Camila does have a decently big scar. It is on her just a few inches, but it is from, you know, right in the middle of her chest. But Camila was at that point just in a diaper, so a lot of these pictures, it's her last pictures without having a scar on her chest. And I don't care that she has a scar on her chest. It's more of what it reminds me of. It reminds me that of everything she's been through, and in a way it's kind of like it reminds me that Camila's been through so much, and she's such a strong little baby. But it also reminds me of there's still so much more to come. So it's just, I see those pictures, and sometimes they make me a little sad. It's just because I see they were just her last pictures before that scar, before that constant reminder of something's wrong with her heart. But we're with Camila. We're soaking up all the time that we can with her right before she's about to go into surgery. And I mean, it's never enough time, but eventually a nurse does come in and he tells us, you know, you guys take all the time you need. Whenever you're ready, I will be taking Camila back to the operating room. And we had Camila for like 20 minutes, just holding her and soaking up as much Camila time as we can with her. And eventually we give her to the nurse. And I still remember, so I saw like such a clear picture of this, of giving Camila to the nurse and me just trying to keep it together as much as I can. And I remember just him holding her and walking, like turning around and walking down the hallway. And we and Ben just stand there until we see him turn into the operating room. And at that point, like my heart just sinks to my butt. I mean, I don't know how to feel. I'm so nervous. I mean, I've been told step by step of what the surgery's gonna look like, and I'm gonna be getting an update every 90 minutes, but it's just still so nerve-wracking and you don't know how to feel. We go into the waiting room and there's like a private waiting room that me and Ben were able to go into, which was nice to have to ourselves. That entire time, I was just so anxious the entire time. I mean, my daughter's having heart surgery. She is 2 weeks old and she's having heart surgery, and I am trying to keep it together. I'm trying not to burst into tears. I think the best way I can describe the way I was feeling was when you're riding a roller coaster and you're at the very top and you're about to do the first big drop. And you're right at the top and you can feel the drop coming. And you're like holding your breath and your heart is in your stomach and you can't breathe and you're just like frozen. That's how I felt for like 5 hours. I felt like I couldn't breathe for those 5 hours. I couldn't focus on anything in those 5 hours. Ben's parents had brought us some bagels and coffee, and I mean, that was the only thing I was able to kind of do. I was stuffing my face with bagels because I just didn't know what else to do. I couldn't be on my phone because I just couldn't focus on anything. I was calling my mom whenever we'd get an update and just, you know, she was trying to be there for me as much as she could because she couldn't be in the hospital there with me. Every 90 minutes, a PA would come out and she would explain to me, you know, what's going on and the progress in the surgery and how Camila's doing. And every 90 minutes, I just counted down to the next update because I needed that. I needed to just know that Camila was okay. Something else that just happened to happen was her cardiologist kept walking back and forth from his office to the OR. Because this band needed to be tightened to a certain amount, Camila's oxygen level needed to be about 80. There was a lot of adjusting to do to the band to make sure her oxygen levels were at around 80. So he was going back and forth, also just kind of checking up on our progress. Every time he passed by, he would always give us an update too. So that was really reassuring because I really needed that. I really needed to hear that she was doing good, not only from the PA, but also from her cardiologist, just because I feel so comfortable with him and I trust him so much. So hearing that from him every 30, 45 minutes just was really needed, and I appreciated that very, very much. The entire surgery from when they took her to when we got her back was about 5 hours, and those 5 hours just were so long. I just sat and ate bagels and was counting down the minutes until the next update. I remember me and Ben weren't even sitting next to each other. We were both so anxious we couldn't even be around each other. We were just freaking out about the situation. He was like on one side of the room and I was in another, and we were like talking here and there, but we were both so anxious that it was just so silent in that room. Just to move up and do something, I just kept going to the bathroom because I didn't know what else to do. I couldn't focus on anything else. I tried to get my mind off of it, but I couldn't. Once the surgery was finally over, her surgeon came into the waiting room and he was wearing a mask, but with his eyes I could see that he was like happy. Like I saw him like smiling almost, but with the mask on. So I felt a sense of relief like instantly, just kind of like, okay, like it's done and things went well. because he was happy. I can just see it, I can sense it. So I was instantly just relieved. I felt just so ready to see her, and I was just so happy that he was there to tell me everything, you know, how everything went. So he came in and he did tell me that surgery went very well and that Camila did great, and Camila's oxygen levels are in the 80s, which is where we want them to be. He did have some pictures of her heart, like her chest open with her heart. And he's asked me, did I want to see them? And I was like, yeah, of course I do. I want to see what you did. I thought that was so cool. I thought it could be kind of weird, but I was so fascinated with surgery. So it was kind of cool. I still have those pictures. You know, he explained to me what he did and that the surgery went well. He did ask me if I wanted to go see Camila. He did tell me that Camila still had a breathing tube in, and that would hopefully be removed soon, depending on how she was doing. And she was still sedated, but that me and Ben were able to go and see her. So he walked us over to the room, and I had to remember, like, Camila was going to look very, very different than what she did just 5.5 hours ago. Camila, when we walked in, did have a breathing tube, and she did have an IV in every single limb. She had 2, I believe, in one of her arms. Camila was just in a diaper, and she had her incision, of course, on her chest from about like an inch down from the bottom of her neck to like above her stomach. So just a few inches, but for her, on her, it looked pretty big. And that was sealed by it looked like a hard glue almost. Some stitches and then a hard glue. And Camila had some stickers on her forehead. She had the tube down her mouth. Camila was extremely swollen from her entire body. She didn't look like herself. She looked like a different baby for sure. I definitely wouldn't have been able to tell that was my baby if it wasn't for the amount of hair she had. But it was very hard to see. It was very shocking. You walk in and you see a bunch of machines. You see a bunch of IVs. You see what looks like a big mess, a tangled mess of IVs, but they are all labeled, and they are telling me that Camila's on, she's still sedated, she is still pain medication, and she has the breathing tube in, and it's really sad to see. The entire OR team was there, the anesthesiologist was there, a bunch of nurses were in there. And we only had a few minutes before we had to leave. They did allow us to see her for a few minutes, but then they wanted us to go. At that time, I was very happy to have her out of surgery, but it was very hard to see her. But I know that the surgery had gone well, and they had accomplished what they needed to with the PA band. I mean, I appreciated her surgeon so much, and I really just wanted to go up and hug his surgeon, but I couldn't because of COVID. I told him if I could hug you right now, I would. And he had told me he was going to be checking up on Camila throughout the day. And I will go ahead and insert a picture of what we saw when we first walked into the room, and just like the shock factor that we walk into. It is a bit of more of an alarming picture, so I will say please skip ahead if you don't want to see it. She will be connected to quite a few IVs, and you will be seeing quite a few machines. But I do think it's important to show the magnitude of what Camila went through at such a young age. I mean, she went through her first surgery at 2 weeks old, and this surgery was just the first of more to come, and we knew that, and that was very hard to know that this is still just the beginning.